In 2015, UN member states committed to achieving universal health coverage by 2030. If this ambitious goal is achieved, it'll mean that in around 10 years' time, people all over the world, regardless of where they live, will be able to access quality healthcare without suffering financial hardship. Given that half of the world's population still lacks essential health services, this might seem near on impossible. The barriers are particularly significant for underserved communities, where a lack of medicines, equipment, and staff can be an issue. Digital health solutions are helping to tackle these challenges, but what exactly does that look like in practice? Well, essentially it's the use of digital, mobile, and wireless technologies to help achieve those critical health objectives. Think mobile health, e-health, and telehealth, which involve the use of mobile devices, electronic processes, and telecommunications, all to improve healthcare. Then there's blockchain, there's big data and artificial intelligence, as well as the Internet of Medical Things. That all might sound really complicated, but it translates into life-saving interventions, like the live streaming of ultrasound exams, which allow doctors and nurses working in different locations to collaborate and share health data and medical advice. Or self-help apps like Pregnancy Plus, which helps pregnant women and their partners navigate that roller coaster of events, feelings, and decisions during pregnancy. Thanks to such innovations, the role of digital health, especially in underserved populations, is increasingly being recognized by patients, health workers, and that wider global health community. In fact, the Philips 2019 Future Health Index report found that healthcare professionals' experiences had been positively impacted over the last 5 years by the increased data that digital tools are providing. Similarly, patients with access to their own health data said the quality of care available to them was much higher than those who didn't have the access. And in terms of that wider global health community, well, currently 58% of WHO member states have an e-health strategy, and then 87% have at least one national mobile health initiative. But it's perhaps not the countries that you'd expect that are buying into such tools. Philips's research found that emerging countries such as China, Saudi Arabia, and in some cases India and Russia, well, they're leapfrogging more developed countries when it comes to the adoption and use of new technologies. In 2018, all WHO member states adopted a resolution calling for a global strategy on digital health to support national efforts to achieving UHC. The Global Digital Health Strategy will be discussed at the World Health Assembly in 2020. Then there's the Declaration of Astana. Also signed in 2018 by heads of state and government, it identifies digital and other technologies as the key drivers to deliver on the promise of affordable, quality, primary care for all. While we could get carried away, it's important to recognize that digital health is not a blanket solution to all global health challenges. We need to be realistic about its applications and its limitations. With that in mind, WHO has released a set of digital health guidelines to help the sector acknowledge exactly when digital health technology could help. For example, they recommend digital tools to help prevent medicine stockouts, but only in settings where supply chain management systems are able to respond to the problem in a timely manner. Or, in the case of telemedicine, they recommend that initiatives should complement rather than replace that face-to-face healthcare service. Digital health can also only be rolled out in an enabling environment. According to WHO and the International Telecommunication Union, that means the presence of 7 different factors. That includes leadership and governance, strategy and investment, services and applications, standards and interoperability, infrastructure, legislation, policy and compliance, and a workforce. And of course, as with most global challenges, no one can do it alone. Success in establishing long-term, scalable digital health interventions depends on cross-sectoral collaboration. Some coalitions, partnerships, and initiatives are already in play, and they focus on things like improving the availability of data or building e-health leadership. But there could always be more. Digital health on its own will not be a solution to achieving UHC by 2030, but it is propelling us forward. It's breaking down those barriers to healthcare access, it's enhancing the information, and it's boosting the quality of care that people are able to receive. When used alongside other approaches as a tool for strengthening existing health systems, it plays an even more significant role in getting us to UHC and ensuring that no one is left behind. However you look at it, UHC is only going to be a reality if digital health is a part of the plan. To what extent can digital health help us achieve UHC? Let us know by leaving your comment below.